Dr. Henderson, is the Neuro-Luminance Ketamine infusion protocol different from what other infusion sites are doing?
Yes, indeed, the Neuro-Luminance Ketamine infusion protocol is different from what has been done in research studies, and it is based on our extensive understanding of neurobiology, neurophysiology, and pharmacology. So the first thing to understand is that in ketamine infusions, only a portion of patients will experience that immediate benefit. In the single infusion studies, 60% of the patients experienced an immediate benefit where they felt better within hours or a day of treatment. And in the multi-infusion studies where they gave 3 infusions a week for 2 weeks or 6 infusions in 2 weeks, after that first infusion, only 25% of the patients felt different. So realistically, you have a 25 to 60% chance that you'll feel better after that first infusion. Or the other way to think of it is you have a 40 to 75% chance that you won't feel any different. Now, it's important to understand why. With ketamine, what actually occurs is 2 effects. One is that immediate anesthesia effect, and the other is reversing the damage that depression causes. Now, this slide shows us a normal, healthy neuron with lots of branches in the dendrites, or the tree of the neuron. And this is a depressed or stressed neuron. See the loss of branches here? And if we take a look at one dendrite and we look at the little synaptic connections here on the dendrite, you can see there's lots in the healthy control, but in a depressed dendrite, there's loss of these synaptic connections. So what ketamine actually does is when it sits on that NMDA receptor, it is activating brain-derived neurotrophic factor, or BDNF to its friends. And BDNF begins to repair the damage caused by depression. So it causes dendrites to rebuild synapses and make new synaptic connections. It causes dendrites to form new branches, and it causes neurons to recover and form new circuits. And there's even evidence that ketamine induces pluripotent stem cells to differentiate into new neurons. So our understanding of the neurobiology of how ketamine actually works in the brain tells us that that first infusion, it's going to be a bit of a wild card, but it's setting in motion these repair mechanisms that will help the brain recover from depression. So what we do in kind of a real-world way is if we administer a single infusion and then we observe the patient over the next 1 to 2 weeks. We do this in part by the use of a patient diary, but also with clinical follow-up appointments, which can be done either in person or by telephone. And based on how the patient is responding, their trajectory of response, we then will schedule further infusions.